Welcome to FNT, Functional Neuro Talks with Precision Brain Center.
All right. Hi, everyone. Welcome back to Functional Neuro Talks. This is a little bit more of a laid back setting. We're testing out virtual recording today. So if you hear sirens or anything like that, just bear with us. So today we're going to be talking about cognitive decline in all ages, but we're also going to tie it in with dementia and Alzheimer's disease. So we're going to jump right in with Dr. Gabella. So what exactly is cognitive decline if you were to give it a definition?
Yeah, that's a really good question, and it's something important to understand and to learn about when you're young, right? Because our goal is always we want to catch this stuff early. We want to prevent it before things progress to dementia or Alzheimer's disease. So, unfortunately, in our society, a lot of times people do suffer from cognitive decline, but we typically just brush it off as, oh, it's normal, right?
Mhm.
So when we think about cognitive decline, we're obviously cognition is our thinking networks, our ability to remember something, retain it, our ability to create new memories. So specifically, if you're reading a new book, you should be able to recite or kind of summarize what you just read, and that should stay with you for at least a few months, right? If you notice, hey, maybe I can summarize it shortly after, but within a few days, I can't remember it, that's problematic, okay? So we're looking at that short-term working memory function. We're looking at our processing speed too. So it may not show up for me as forgetting where I put my keys, that short-term memory component, but it could show up as all of a sudden somebody's asking me a question and it just takes longer for me to process what is being asked, and then obviously to create an answer in my brain and articulate that answer. So it's many different things, but in summary, I think everybody can understand and grab onto the idea of cognition, your ability to think, process. You meet people that you're like, wow, this person is just brilliant, super smart, they can learn just about anything, right? So that's what we're looking at when we're saying that's really good cognitive function. We have those super learners or super brains. And then you look at somebody who's a little bit slower, right? They can't adapt, learn new things on a computer. They have challenges learning anything new, really. And then their problem solving ability is also affected as well. So your ability to problem solve when something comes up that's unpredictable is an important function of our cognitive networks. So that's what cognitive function is. And I think as a whole with society, we've definitely just kind of accepted these things as being normal when they get worse, right? And that's not normal. So really the stuff really shouldn't be showing up as getting worse until 50s and 60s. You should have a pretty sharp brain throughout your 30s and 40s. And you're starting to see that people are thinking that it's normal in your 30s. Hey, I hit 30 and, I have ADD and I can't focus and it's hard for me to retain information. That's not a normal thing, right? And it could be coming primarily from a brain deficit. Maybe it's hormonal. It could be many different factors. Maybe it's toxins in your environment. So that's kind of another subject for another day. But the important take home is our cognition, our ability to think, problem solve, and have memories is directly connected to our personality and directly connected to who we are. And that's super important to understand, because if we cannot build new memories, if we cannot hang on to these memories, we lose who we are as people. Our personality will change. And I'll bring that back up again when I answer a few more deeper questions regarding dementia and Alzheimer's. But yeah, it's a thing we need to start prioritizing at a much younger age.
What are some things we can do to kind of prevent it or, keep your cognition sharp as you are younger?
Wonderful question, because we have tons of research on this stuff. So when you have a higher education, okay, those are the people whose brains age better. So going to college is a good thing simply because you learned more, right? You have more information in your repertoire, even if you don't end up using it. But the key to that is understanding being a lifelong learner, right? It doesn't stop after college. Like, you need that curiosity, that desire to learn new things, not say stagnant in your basic understanding of stuff. So it could be any concept that you want to specialize in that you can like get passionate about and learn. So that's like number one.
Mm-hmm.
The other thing we're also finding too is that the exercise is a huge component. So when we talk about our working memory storage, that all starts in the hippocampus. And we now know that we can increase the number of neurons in the hippocampus if we do cardiovascular activity. So you can break that up. Yeah, you can break it up into 15-minute intervals, or you can just walk for 45 minutes every day. Like everybody can do that. That's accessible to everyone. And we're literally able to show under electron microscope that you increase the number of neurons in that hippocampus. It's incredible.
So fascinating.
Yeah, for sure. Yeah, and then overall, our lifestyle choices, like choosing to really respect education, but not necessarily education in the academic realm, but just learning new things. Like there's families that go to orchestras or they go to plays and they're culturally being exposed to all different things. Those kids are their whole life is going to be about learning and engaging in new. Novel is the key word. So we don't want to get stagnant where we do the same thing over and over again. The brain needs novel stuff that's new. So getting out of our comfort zone is really, really good. So that cultural aspect of, experiencing new things, learning new stuff, and always for the rest of your life being a lifelong learner. It's super helpful for a good aging brain.
So when we get into dementia and Alzheimer's disease, what exactly are the differences between the two?
Great question. So that's why we're even talking about cognitive decline, because we are in a state where we're seeing this big epidemic of increased rates of dementia, increased rates of Alzheimer's disease. So it's very confusing because I think a lot of times we never separate the two and they kind of just get grouped together and people are like, well, what's the difference, right? So dementia is a symptom, right? And dementia means that there's cognitive decline. There's memory deficits that are now pathological. If somebody has dementia, it's labeling the symptomatology, right?
Okay.
Many diseases, a specific disease can express dementia. One of those specific diseases is Alzheimer's disease. That's a specific disease. So typically in this, we distinguish between different types of these different neurodegenerative disorders. There's frontal temporal dementia, there's Lewy body disease, there's your Alzheimer's, which are typically going to be your beta amyloid and your tauopathy. So what those terms are, those are terms for the proteins and the plaquing that distinguish the disease. So when we have neurodegeneration throughout the brain, what happens as a side effect is we get these protein tangles. They're byproducts of all these neurochemical reactions that are happening in the brain, and they're pathognomonic for the disease. So if you see, and this stuff is really not happening until autopsy and things like that. But if you're seeing amyloid and you're doing these tests on a living person and you're saying amyloid body or you're seeing tauopathy, we know that is distinct for Alzheimer's disease. Some tauopathies we see in dementia as well. The other differences between these diseases is looking at where the migration is. Okay, so even in Parkinson's disease, the protein buildup is alpha-synucleinopathy. It's a neurodegenerative disorder. There are many variants of Parkinson's disease. Some of them are a ton of cognitive decline, right? It's going to be associated with a lot of anxiety, cognitive decline, things like that. Some other ones are more motor components. So you're seeing more of the tremor, the walking, the freezing, the falls, things like that. So it's Parkinsonian syndrome, Parkinsonism. There's these big groups. Then we have different diseases that are a little bit more aggressive, like multiple system atrophy, that are a little more scary. But again, these are neurodegenerative disorders. They progress and they get worse, right? So going back to that question, like what is dementia? Dementia is a symptom of cognitive decline. It's saying, hey, this person has cognitive decline. They could have multiple system atrophy, right? They could have Parkinson's disease. They could have Alzheimer's disease. Alzheimer's disease is a specific disease. Now, typically what we'll see in the frontotemporal dementia, now that is a specific disease, is the migration from the frontal and the temporal lobe. You see these tau buildups in that area. Classically, what that means is you see personality changes before you see cognitive decline. So those are the ones where the personality changes. They become either addicted to stuff, maybe they're doing gambling, or maybe they become hypersexual. Like you'll see some of that going on. They can become really super nice, super sweet, sometimes mean. The mean nature, that more combative nature, we typically see that presentation in Alzheimer's disease. Alzheimer's disease is more of a global type of neurodegeneration. Those plaques and protein tangles can get laid down globally in the brain, mostly in the cortex is what we see. I'm going to add Parkinson's in there just to make the distinguish the difference with Parkinson's. Parkinson's, it ends up affecting your frontal lobe, but it starts, and it can migrate up through the olfactory bulb as well, which is our ability to smell and stuff. But it starts in that substantia nigra, right? And what's crazy about Parkinson's disease is before they actually have a tremor, they have lost 90% of the cells in their substantia nigra. So they went on, they didn't get diagnosed. They lost 90%. So if they would have got diagnosed, or somebody would have caught something at 10% and said, hey, this isn't right, you should probably go see a functional neurologist or brain rehab, that Parkinson's can be prevented, right? So unfortunately, when we live in this realm of not diagnosing things until the full disease expression, that's where it's a little bit trickier. So the more we can educate people to know, hey, cognitive decline is not normal, right? And then you theoretically, they go get treatment. You have all these biomarkers with your vestibular system, your eye movements. It tells exactly what areas in the brain aren't working well. You fix that, the patient could be prevented from developing these diseases altogether, which is absolutely huge. And that's important to understand. Like once you start having these things, it's not like, oh no, I'm destined to develop dementia or I'm destined to develop Alzheimer's disease, because boy, is this stuff awful. Mm-hmm. If you have somebody in your family that has any of these symptoms or the diseases, you know how terrible it is. It's soul crushing.
Kind of going off of that, and you mentioned this earlier about how our society kind of just accepted a lot of cognitive decline as almost normal. Yeah. So to like what extent is some cognitive decline normal for an aging brain, and right. What is kind of a telltale sign that, okay, this is more than just the typical memory loss?
Yeah. So, okay, it's very personal, right? So if you're asking me, my answer for myself is going to be set much higher because I understand the brain. I understand what's, real. So what I would say is let your tolerance be lower when it comes to this stuff, right? So especially if it's like little things you can do at home, like working out, right? Or maybe you're going to start playing more brain games, or you're going to start learning new material and things like that with keeping your memory strong. I would say do it. That short-term memory is huge. So there's not a straight answer for that. The question is do you want to be like a super ager? So now we're studying these brains and we're saying like these people are super agers because they're in their 90s and hundreds and they're so sharp. How did that happen? And so what's pretty cool, when they started looking at a lot of those people in those blue zones and they started looking at their lifestyle and their habits, they weren't just physically active and their brain's deteriorating. When your brain deteriorates, you no longer are physically active. So these groups of people that were able to maintain their physicality, their social skills, they had great brains, right? They were super sharp. So they're also those great agers, those super agers, and the brain stayed healthy. And it was lifestyle choices ultimately. Like we want to eat better. We want to stay physically active. We want to have that social community. That's going to be a big challenge for these younger generations that are so used to being on computers and, the social media realm. We're losing that connection, that social interaction. And boy, body language, right? Like most of the time, how somebody is feeling, not based on words at all, because you were able to read body language, right? And you can feel their emotions. That stuff is going to be all gone. And that's a big part of that social understanding, social interaction.
Really interesting.
Yeah.
So I know, you brought up earlier when you have a loved one that is going through this, and it is really devastating. What are some maybe activities that you would recommend you can do with those loved ones and maybe try to help keep them a little bit sharp?
Yeah, that's a really great question. So a couple things that are nice and easy enough to do is we want to keep them as active as they possibly can. So one of the better activities is going to be something like dancing. I think everybody can dance, right? So if you can get them wanting to dance, When we're thinking about our memories, there's certain sensory systems that really help trigger some of those memories, some of the personality to come through. Playing music can bring somebody alive, right? Because that's coming in your auditory cortex. That auditory cortex is in your temporal lobe. Your memory center is in your temporal lobe. So when we're dealing with these neurodegenerative disorders where they're having degeneration within the temporal lobe, they're losing their memory, their personalities are changing, we can use music to bring them alive, to bring that personality back, right? So it's very therapeutic, dancing, any form of dancing, right? We looked at Tai Chi is really great, or Qigong, these types of balance, movement, awareness of your body, if the person is able to do so. If they're so deteriorated and they have massive balance issues, because here's the thing, when your cortex degenerates, your balance gets worse. You're at risk of falls. A devastating thing just happened. I was in Target and a lady fell, hit the concrete, cracked her head open, right? So we know that she, out of nowhere, she just happened to fall. So we know that her brain wasn't doing well to begin with because it was not able to prevent a fall. So it's a big thing. It's important to discuss because it goes hand in hand. As our cognition deteriorates, and you can even be in your 40s and you're like, wow, my balance is not good. That in itself is a warning sign. Hey, my balance should be good. This isn't a normal variant. It generally is not going to get better on its own. We need to do some balance exercises, maybe find a functional neurologist, maybe start considering, hey, this might be a serious symptom if I'm having short-term memory loss, things like that. You shouldn't walk into a room and be like, what did I come in here for, right? That's a problem. You shouldn't be, at work and your coworker asks you a question and there's this long delay because your processing is so slow. Those are not normal. If you were not like that 5 years ago, 10 years ago, it's probably not normal, right? Yeah. So I'm not sure what question. I mean, that might have been normal. I just got sidetracked. Pregnancy brain is in a little effect here, but what was I don't know what I was answering.
That's okay. Yeah, just activities
activities. Okay, so like Tai Chi, really good. Yoga. If they can only walk, just walk with them, right? Walk with them. And you can give them different activities. They can lift dumbbells. We do know with some more movement disorders like Parkinson's, boxing is nice. So if they like, I think it's rock steady is a good one if they like to do boxing, like an air box or things like that. If they have enough integrity of their brain, doing little puzzles and just daily things, just activities, getting them engaged in the community. That's why it's good with these retirement communities that have activities. It's huge. Staying at home and being sedentary is only going to cause further neurodegeneration. So being active, right? We want to engage the brain, learn new things. The other thing that's really helpful is smell. So our smell also goes to our temporal lobe. So we got hearing and auditory cortex in the temporal lobe. We got smell in the temporal lobe. We know that Parkinson's gets affected on smell, dementia gets affected. All these smell tests are pathognomonic for these neurodegenerative disorders. We can use smell to bring somebody's personality back, right? We can use smell to activate those neurons there. And so it can be used therapeutically as well. So essential oils, perfumes from what their partner used to wear, different smells of food and cooking, and if they were in the garden, if it's basil, whatever the scenario is, you can use all different smells.
It's awesome.
Yeah.
So I guess if you were to kind of tell us a little bit about functional neurology specifically and how we treat cognitive decline, just to give people a glimpse into that.
Absolutely. So I wish I could summarize it to something nice and simple. We always address everything patient specific. So there's really cool biomarkers. I'm just going to use eye movement as an example. So we can measure the speed, velocity, phase, all this stuff of eye movements, specifically saccades, which is a fast eye movement. My eyes are center. I jump to the right-hand side. That fast eye movement is called a saccade. The latency, how quickly my brain can fire that eye motion is a function of our frontal cortex. It's done in the frontal eye fields. It's an area that's involved in cognition, our personality, all things like that, because we have all these indirect pathways, meaning I have a group of neurons that do one thing, but so many other areas of the brain are firing to that location, and that location is firing to so many other areas. So it's connected within this cognitive network, right? And we want to always think of our brain as networks because that's the truest form of how our brain really works. And so there's a lot of things involved to result in our human expression. So if I measure the latency of saccadic eye movement in a healthy brain, I want to see that less than 200 milliseconds, or at least close to 200 milliseconds, right? Most of the time with the patients we see, it's not. Okay. So you can be 18 years old and have a latency of 330. That's way too long. 400 and something, way too long milliseconds. We know that frontal lobe is not doing well, right? The other area of the frontal lobe that's really super important is our dorsolateral prefrontal cortex. It's very much involved in this deeper complexity of cognition. Personality as well, hugely implicated in depression, which is why a lot of these neurodegenerative disorders, we see depression come hand in hand with it, right? Because as your cortex degenerates, depression is more likely to come about. We can measure the integrity of that dorsolateral prefrontal cortex by doing anti-saccades. It's another type of eye movement. We get these biomarkers that we can quantify. So it's no guessing, it's not subjective. It's not just some patient reporting symptoms. But yeah, throughout the whole entire exam, like our exams are measuring exact areas of the brain and saying, is this healthy? Is this good? Is this bad? And then we're deciding, okay, what areas of the brain do we want to activate? And it's always a priority. I mean, number one, we got to make sure our autonomic nervous system or autonomic network is healthy enough for us to activate the brain. But once we know it is, then we're going to say, okay, what's the integrity of our cortex? What's the integrity of the frontal lobe? And if it's healthy, we can go to town with doing activities to activate it. Sometimes it is like a cognitive task. Sometimes we do what's called memory saccades, which you have to think about it, or we'll do a verbal memory task and we'll combine it with different SSEP, electrical stimulation on the face, combined with eye exercises. Maybe we combine it with tilt table. Maybe we combine it with some complex movement pattern. Just depends on the patient.
Awesome. Well, thanks so much for sharing. Those are all the questions I have for you. Is there anything else you want to add on the subject?
Oh, that's awesome. So I guess the main take home is that I think as a whole, as a culture, Americans really need to start saying cognitive function is super important, right? And if we don't start thinking about it today or in our 20s, when we're teenagers, bad things are going to happen. And here's what we know. Every time we have a concussion, you have structural changes that you cannot come back from, right? We can increase the functionality, we can increase the network, give you function back, but your brain would have been healthier without that concussion, right? So doing things to avoid a concussion, maybe making lifestyle choices that we're not putting ourselves at risk of these significant TBIs or traumatic brain injuries, making choices that we are saying, hey, education and learning is actually really important. I think our academic world has been just so non-fulfilling for a lot of people, right? Like I'm not in support of this boring college education because unfortunately, depending on your grade, that's the nature of it. But it's more of like, hey, we have access to the internet today. You could literally learn whatever you want to learn, which is incredible. It's at our fingertips. So let's start harnessing that, to keep our brains healthier. Let's make better choices. Because let me tell you, here's another cool research that came out about alcohol. So certain alcohols are given like a value of like 1 or 2, right? So for a beer, the value for having a beer is 2, okay? So you shouldn't exceed 21 points in a week. So what that equates to is 10 normal beers. These aren't like really high alcohol beers. These are 10 normal beers is the alcohol intake you should have in a week to keep your brain healthy. So then let's go back and think about how many times people are just binge drinking. Binge drinking is absolute worse. And then we live in a world where it's now acceptable to just be an alcoholic all the time. And people aren't even labeled as alcoholics. It's like a cultural thing. Like you're just drinking all the time. Don't get me wrong. Absolutely love wine. Like being pregnant, I miss it. Like it's great to do it socially, things like that. But we need to know if you're doing an excess, there is a consequence, right? Recreational drugs, not good, right? So if you're going to try it, be experimental, fine, be experimental. Don't do that stuff regularly. Like that's going to have a massive consequence. And it's a consequence sometimes people don't come back from. Because like I said, it's really scary when you lose your mind. That is the definition of dementia. When you have such cognitive decline happening, you lose who you are as a person. And that's awful. It's terrible. It's terrible for your loved ones. It's terrible for you. Then eventually you don't recognize your loved ones. It's just awful. Mm-hmm. And the other thing is like, if we start looking at the reality of what happens, is like your brain deteriorates so much that you can shit your pants and it doesn't bother you anymore, right? Like that we don't want to be in that place. And it's important to recognize like this is not I can live the way I want, and then when I'm 80, maybe if I live that long, I'll develop dementia. No, people are developing it in 50s and 60s. It's happening way earlier. So I don't think it's something we can run from. And I think, we live in a world where I think people are more health conscious and we're making better choices. And I think it's empowering to understand it now so you can make better choices for the rest of your life. Yeah. And good nutrition goes far. Mm-hmm. Supplements go far. Good, healthy lifestyle goes far. Doing things to make you happy goes far, right? Making better choices that we know are going to result in like a deeper meaning of life, being happier, right? Are good choices.
Mm-hmm. Well, thank you so much for sharing.
Yes.
And thanks to everyone for listening and joining us today. Be sure to catch us on the next one. Please follow our social medias and reach out to us if you're seeking treatment.
Yes. Thank you.
Thank you.
We hope you enjoyed today's episode of FNT. Please like, follow, and subscribe to our show, and don't forget to check us out on social media. If you or a loved one are seeking treatment, please visit us at precisionbraincenter.com.